family are invited. And you actually get your little pin that says FSCJ radiation therapy. And I will be presenting them to you. We will be doing the ceremony with radiography. So there'll be radiography and there'll be radiation therapy. Dr. Henning will be there. His boss, Dr. Litt, we're inviting. The provost, who is Dr. Wall, we're inviting. They don't usually come, but we have to invite them anyway. And we're inviting Dr. Avendano too, who's the president of the college. They may or may not come. I doubt very much whether they'll actually come, but we invite them anyway. So in a case of, we give you a little pep talk, and Dr. Henning will give a little pep talk. And I'm hoping that I'll get a guest speaker. I'm aiming for those of you who have been at the Proton Center, Ernest St. John. Did you meet him?
Mm-hmm.
I'm hoping for him. I'm actually asking him. If he doesn't say no, if he doesn't say yes, I'm not exactly sure, but we're going to ask. I've got somebody in mind, but I'm not going to say anything yet. I'll show you the pin. I have a
So if we're officially graduated on the 3rd,
Yeah.
what's like our last day of like class or clinic or whatever?
let me see. Oh, May. So it will be the week of April 25th.
So like that'll be the last week.
That will be your last
day
week
of clinic.
of clinic, yeah. So there's the pin.
Oh,
Let me put the light off here. What do you think?
I like it.
You like it? Okay. It is actually based on my school pin. My school, I'll show you my school pin. So you order these through the bookstore. There's my school pin. It's a bit bashed and wobbled at the moment, but that's my school pin. And it's silver. And it's about yay size. But the one that you're getting is smaller. It is basically an inch, 0.875 of an inch, so it's about that size. So it's nice and delicate. And you can, I don't have the prices. I dug out the order form for 2 years ago, which was the last time we ordered pins. And you can get gold plated, silver plated, sterling silver, 10 carat and 14 carat gold. So most people go with the gold plated one, which on this form is $35. Just something to think about. So I'm presuming, let me just knock this down. I'm presuming that you will be bringing family with you for the pinning. Does everybody want to come to the pinning, by the way? Yeah? And you'll be bringing family with you, presumably?
I might not be, we have a family trip around that time.
Okay.
I don't know the exact dates.
Let me know, would you?
Yeah.
And everybody, I presume, is going to graduation?
I don't think I will.
To
I think I'm gonna be moved by then.
Oh, okay. Well, if you can, come, but if you don't worry about it. I'd like to see everybody at pinning if at all possible. I need names later on, but at the moment, we're just sort of doing basic things, so we haven't actually started organizing.
I know last year there was like a limit on how many people you could bring, so
Yeah,
like,
well,
what's it gonna be like this year?
well, we have a large auditorium that sits 360 people.
Wow.
So I don't think we'll be limiting it to, 3 or 4 people, or 2 or 3 people. I'm presuming, parents or significant others or both or whatever, The other thing that we'll look at later on is whether you want to do something like some people get together and dress in the same color or things like that.
There's
So
not like a dress
it's,
for the pinning.
it is,
Usually a dress.
business attire or business. So you can wear, people have worn skirt suits before, people have worn dresses before, people have worn pantsuits before. So as long as it's nice, and I don't want to see anybody in jeans.
I thought
Obviously.
maybe scrubs. I know the nurses had to do. my sister
Yeah,
did
no, we don't do that.
Okay.
We don't do that. It's a tradition for the nurses to go in scrubs because they wear their silly hats.
Mhm.
And thank God we don't have to wear them anymore. So, yes, I know, silly hats, but yeah. So that's a tradition for the nurses, we don't do that. We tend to go, because we're professionals, we tend to wear professional attire, shall we say. One thing I will say is that one of the pinnings that I was at several years ago, maybe 4 years ago, everybody gets pinned, so you pin on the collar, or you pin on here, or pin whatever, and I will be pinning, so please have something for me to pin. There was one of the girls, 2 actually girls in this particular class, and I wouldn't even mention which class it was, and they were both big girls, and one had spaghetti straps where you really couldn't put a pin, and one was what my mother used to call a boob tube, sort of strapless thing. And luckily enough, it was the female instructor that was pinning, not the male, because she basically couldn't find anywhere that wasn't indelicate to put her pin. So please don't do that, not that you guys will. But please don't do that. Please don't do that to me. Otherwise, Dr. Henning, I'll never hear the end of it. So professional attire, dresses, skirts, suits, whatever. And if you guys want to get together and decide what you want to wear, that's fine. But you've got 4 months to think about it. The other thing I was going to mention is the registry. You can start applying for the registry 3 months before you graduate. So you graduate on the 3rd of May. So you can start applying to the registry February, March, April, May. 3rd of February. And you'll be doing it online this year. They've just started, everybody can register online. And closer to that time, I'll go over what you have to do to register online, okay?
So we register ourselves online?
Yes,
Okay.
yeah. I'll give you the instructions and you have to get an account and register online, and then it comes over to me to make sure that you have done everything that you need to do, and then it gets sent off to the ARRT, and then they'll send you a number, and then you have to apply for an exam date. Does that make sense? Okay, so, has anybody read through this yet? I would suggest you start. So, chapter 1 is, you really don't need to do anything with it. Is good study habits in health professions, study with and without a group. Are you guys doing study groups? No? No, okay.
I don't even know what day we do that.
Oh,
Well,
yeah.
no, I know it's difficult when you're working 4 days a week and you're here
Yeah.
on the 5th, so. My thought would have been that you'd study, you know, get a WebEx or something together, or a Zoom or something. That would be what I was thinking, but again, you know, you're working till 4 or whatever. And, you know, you come home, you eat, you go to bed, right? Okay, so, developing school habits, so, so here's an interesting, and actually I've never noticed these before, but let me just see what they say. If you haven't looked through this, you'll not notice that there's answer keys at the back. But if you're doing the questions, please don't look at the answer keys first. Do the questions, then look at the answer keys, okay? So, let's talk about these. Review exercises, it says. Huh?
So where are we at?
Oh, I'm sorry, page 20. Who hasn't got the book yet?
Well, I have it set.
Yeah, you haven't got your book, or you haven't brought it with you?
Completely in the dark about it, honestly, just completely dropped it, that ball. It's just sort of rolling around.
So you
for
are
somewhere in
going
the
to
dark.
get it, right?
Yes, I will get it.
Okay, the other thing, there's 2 books that I would suggest, that this one, which was mandatory, and that one.
That
So-
one I've seen, the other one I haven't seen.
Yeah. Yeah. Do you need a picture of it, or do you have?
Yeah, I'll take a picture.
Yeah.
Thanks.
And you might want to grab the ISBN number as well. It's on the back. Okay, so. So it says here on page 20, name at least 2 things to do before class to gain more out of what is presented in the classroom.
Read the chapter.
Read it. Oh dear.
Sorry.
That's right, wreck the place. Read the chapter. Okay. Actually, you said it right, yeah. What it says here is, before going to class, activities that will aid, focus, and identify the most important ideas to note are: read and review the topic to be covered, review previous notes, write down any questions you may have, come prepared by having read and completed assignments. So there you go, okay. So identify the parts of the study goal represented by the acronym GOAL. Goal is G, make it specific. Obstacles, identify potential problems. Action, apply effective methods. And learned, confirm what you have learned. Yeah, a little bit. Okay, here's a goodie one. Cell phones can cause distractions during study sessions. List one way that this disruption may be limited while studying.
Don't have
Switch
your
the
cell
damn thing
phone.
off. Distractions and interruptions interfere with deep learning and result in the need to repeat and review. Put phones on vibrate or have voicemail pickup calls. Place your phone where it is not easily available while you're studying. Establish a reputation with others that your designated time is not to be disrupted. Okay, so let's leave that. So let's go on to, this is basics now. So we're starting basically, we're starting from basics. Overview of cancer and management modalities. This is chapter 22, page 22. Would you rather me skip this and just go into overview of cancer just go into the questions? Let's go into the questions and see what you get. Okay, so we're starting on page 30. Mortality rates are based on the number of persons per what of population? Everybody? So A is 1,000,000, B is 1,000, C is 100,000, and D is 50.
100,000.
100,000. Everybody remember that? Stephanie. Stephen, okay. Any substance or agent that produces or incites cancer is called what?
Carcinogen.
A carcinogen, yeah. Carcinogen. Seven warning signs of cancer include all of the following except, so it says thickening of lump, nagging cough, pain, or change in bowel habits.
Pain.
Pain, yeah, remember, cancer doesn't always cause pain. Very rarely does it cause pain. TNM staging system. What does it evaluate? The size and extent of the tumor, whether the primary tumor has metastasized, or the grade of the tumor. And D is A and B, and E is A, B, and C. What is a TNM?
A, B, and C.
A, B, and C?
Just A and B.
A and B. TNM does not take into account the grade. The grade is totally separate. It's tumor, node, metastasis. Nothing about the grade. Malignant neoplasms that originate in lymphoreticular tissues are called what? Then it has sarcomas, lymphocytomas, lymphomas, or lymphoreticulomas. Pardon? Lymphomas, yeah. I had one group say lymphoreticulomas. No such thing. No.
I circled it and then erased it. So somewhere my brain went, I've never heard of that in my entire life, and erased it. So.
Okay, so lymphomas, right. When more than one cancer modality is used simultaneously, it is known as what?
Concurrent.
A? Everybody agree with A? Yeah, that is concurrent.
That's what A says, concurrent? I don't have the book. Okay.
Yeah,
Okay.
yeah. So the four answers are concurrent, concomitant, systemic, and immunotherapy. Okay, so, oh dear. Oh, okay. The class of cytotoxic agents that has the potential to burn the skin of the administrator is, and of course, if you read the actual chapter.
Alkylating? That's what I have circled. So
So say again?
the A, alkylating agent.
So there's alkylating, anti-metabolites, plant and alkaloids, and hormones. So it's A. This is a gimme. This is an easy one. Cancer warning signs most likely to indicate colorectal cancer.
Change in bowel habits.
Change in bowel
If
habits.
you're pooping 10 times a day, you might
So
have
the
cancer.
four are, for those of you who don't have the book, pain, a sore that will not heal, a change in the wart or mole, and change in bowel habits. Okay. Which of the following cytotoxic drugs may produce heart failure? And they are for methotrexate, actinomycin D, adriamycin, and bleomycin.
Could you say those again? Sorry.
Okay, which of the following cytotoxic drugs may produce heart failure? There's methotrexate, actinomycin D, adriamycin, or bleomycin.
I just read about these two, none of them are standing out.
I don't know any of
I don't
them.
remember. I didn't have anything circled, so.
It's actually adriamycin. And what they'll do if a
I heard the opposite. I heard it was hardly ever C and to
Really?
never, yeah. If you don't know, to never have C.
Charlie out.
Always pick C if you don't.
Shit.
That's what they told us in
It's
high school.
literally always
anyway.
C.
what?
If you don't know on the SAT or something, just put C.
Yeah.
Dang. I be getting
The-
wrong information.
Yeah.
Someone wants me to fail.
If you have someone who is going to get adriamycin, they usually send them up to nuclear medicine for what is called a MUGA scan, MUGA. And it is a scan to check the health of the heart, to check that the heart is actually working correctly before they start adriamycin, because it is notorious for doing nasty things to the heart. Okay, so a tumor classified as T3N2M0 is likely a stage what? So we have stage 1, stage 2, stage 3, stage 4, and stage 5.
And this is where my confusion is, because we said on the other thing that the TNM does not tell you, I guess that's stage, I was about to say, I get stage and grade all whacked
Yeah.
up, so.
Well, staging,
I do too. I know they're different, but I get them like the
Like,
grade
what's
confused.
what's the difference?
Isn't
Yeah.
grading,
Okay.
I thought, was how changed the cells themselves
Yeah.
are from
So-
how they originally
Cause
started.
this
That's
is what
right.
I was thinking of,
So
so that's what I
stage-
said.
Staging tells you one thing, that how different the cells are from what it should be. So if you get a tumor in the brain, for example, that is obviously lung cells, then it's not a brain tumor, it's a lung tumor that has migrated.
Right.
But if you get a lung cancer that doesn't actually look in the lung, that doesn't actually look like normal lung cells, then it is, the staging is usually high stage, because it is, what do you call, think back, what do you call a tumor which does not look like the tissue that's in?
Well differentiated.
Pardon?
Is it well differentiated?
It would be undifferentiated.
Undifferentiated.
I was
So-
gonna say abnormal.
An undifferentiated tumor.
I
An
think of it as if it's differentiated,
Differentiated.
it still has its identity, so it's still
Yeah, that's correct.
belongs to this particular tissue.
So
If it's
well
undifferentiated, it's.
Well differentiated, the tumor looks like lung tissue. Undifferentiated means that the tumor doesn't look like lung tissue.
That's weird.
Yeah.
It should be opposite.
Yep.
We should talk to somebody about that.
So, what the other thing is that if you have a stage 1, a grade 1, it is usually very inactive. It doesn't grow fast. But if you have a grade 4, then it is a very aggressive tumor.
So the grade tells you how fast it grows.
Yeah.
And
How-
the stage just tells you,
How big it is and how
Okay.
advanced it is. So stage 1 is usually very small. Stage 2 is slightly bigger, stage 3. But the stage also includes TNM. So you have, in this case, you have, where did it go? Stage, so T3N2M0. So T3, that tells you that the tumor is relatively big. N2 means what?
Nodes. 2 nodes.
How many areas of nodes?
2.
2. So we'll take the breast because it's easier to do. So you have a T3 tumor of the breast. N2 means there's 2 sites of nodes. So perhaps you have nodes in the axilla and nodes in the supraclavicular fossa. So that would be 2. So you have T3, the size, N2, how many nodal areas you have, M0, which means that you have no metastasis or no metastasis seen, right? So in that case, your T3, N2, M0 is likely to be a stage 3.
But if there's any metastasis, then it
It
automatically
goes to
goes
stage
to
4
Automatically.
automatically. As soon as you have metastasis, 99 times out of 100, it is stage 4. And it becomes palliative. Does that clarify it just a tad? Okay, good. Okay, the tissue of a malignant carcinoma is epithelial, cartilaginous, skeletal, or neural?
Epithelial.
Epithelial, yeah. The method used to establish definite malignancy is what? And I'll give you the four. Radiologic imaging, hematologic study, histopathologic screening, or clinical staging.
Third one. What was the
Third
third one?
one.
Histological.
Pathologic, which means it's gone to histology and pathology. So that's the people that make the call as to, one, if it is a carcinoma or a cancer, what type of cancer it is. So that would establish a definite malignancy, it'd have to go through those two. Okay, cancerous tumor composed of glandular tissue would be what? A neurolioma, whatever that is. Adenocarcinoma,
Guessing it's not that one.
epithelioma, and chondrosarcoma.
2.
Yeah. Urolioma.
Given that you don't even recognize its existence, I'm guessing it's not.
Yeah, it's not, no. They sometimes sneak these in and you think, it's like the lymphoreticuloma.
Yeah.
And some people will think, oh, that sounds good, yeah, let's put it in, yeah. Okay, so a malignant tumor of striated muscle would be called what? A leiomyoma, a fibrosarcoma, epithelioma, or rhabdomyosarcoma. Yeah, rhabdomyosarcoma. So if rhabdomyosarcoma is the tumor of the striated muscle, what is the tumor of the smooth muscle?
Something sarcoma.
Well, gee, yeah.
I just know the connective tissue ones are sarcomas generally.
Okay,
I don't remember.
so
what
the
smooth
striated muscle is rhabdomyosarcoma. The smooth muscle is leiomyosarcoma or leiomyosarcoma, whichever way you want to pronounce it. Okay, so surgical procedure in which an incision is made through the abdominal wall to examine lymph nodes and establish the extent of a disease is called what? An incisional biopsy, laparoscopy, mastectomy, or radical excision?
Number 2.
Number 2,
Does it say they actually remove anything, or is it just to?
it just says a surgical procedure in which the incision is made through an abdominal wall
Yeah.
to examine lymph nodes and establish the extent of the disease.
Maybe A?
So it's what?
A? Incisional biopsy? They could do it laparoscopically though.
Biopsy would be removal, wouldn't it?
Yeah,
What's 2 is abdominal.
yeah.
lateral.
So
Yeah, that's true.
it
It's
says
probably
a surgical procedure in which an incision is made through the abdominal wall. So it's a laparoscopy. Incisional biopsy means that you're actually taking stuff out. It doesn't say anything on that, on the question about taking anything out. It's just a look-see. You could use the laparoscopy to do a biopsy, but for the moment, that's what it is. Okay. Okay, let's try these ones. The highest incidence, this is number 25. The highest incidence of malignancy for adult males in the United States occurs in the, and there's 3 cancers: prostate, liver, and colon. Which is the highest incidence between these 3?
a prostate.
Prostate, yeah. So the highest incidence of malignancy for adult females in the US, is it liver, breast, or colon?
Breast.
Breast, of course. That's a gimme. Okay. The process by which tumors are induced by certain chemicals or physical agents is called carcinosis, carcinogenesis, or carcinitis.
Carcinogenesis.
Carcinogenesis, yeah. I've seen that come up in tests too, so just aware. Okay. I'm not sure what they're asking here, let me just check. It's been a while since I've looked at these number 2 questions.
For 27,
27.
I'm gonna say, in my personal opinion, weight loss, but
Yeah, so hair loss,
maybe mileage.
hair loss, weight loss, and myelosuppression is the most common side effect associated with cytotoxic drugs. Which one?
Hair loss, weight loss, and what?
Myelosuppression,
With cytotoxic drug?
cytotoxic drugs. Chemo, in other words. What would you say was the most common?
Wait, hair loss, weight loss, or what was it?
Myelosuppression.
Oh, that's, yeah, no, that's, I'm sticking with hair.
I would say no, not hair.
I don't know.
I would say it's not hair because
I feel
not
like
everybody
I'm
loses their
definitely
hair.
teetering between weight or hair, but I feel like it's hair more than anything.
You will 100% lose weight on chemo. You will
You do lose
not
weight on chemo.
necessarily lose your hair. My husband has long hair still, and he's lost hair, but not enough for it to be like noticeable.
They say it's
But-
actually myelosuppression.
I knew you were
I was
say
gonna
that.
say
I
it
was
could
watching
be
the last
it
one.
could be that,
I
but
thought you had to be on it for a long time for it to affect
Well,
your
you
blood count.
do, you are. I mean, you're on chemo for 6, 9, 12,
But don't
15.
some people do like
24
several
months.
rounds compared to other people who do just 1 or 2 rounds of chemo?
Well, most people on chemo for cancer do at least 6 rounds.
Wow.
The ones that are on the 1 and 2 rounds are just basically maintaining, yeah.
Would that be palliative, just 1 or 2 rounds?
1 or 2 rounds, if you get it like that, yeah, it's probably palliative, so, yeah, but myelosuppression is, yeah, that's the one thing that, although hair loss and weight loss come as well, but, okay. Most cancers are, it gives you sporadic or familial.
sporadic. I didn't think about what that was saying.
Everybody agree with that?
I've read, I don't remember what the percentage, but it's a very low
Most
percentage.
cancers are sporadic. The
Of
cancers
familial.
that are familial are the ones that get all the
Gene
actual
mutation.
notice. But most cancers are sporadic, they don't run in families. Okay. Let's skip that one. Okay.
I'm
Okay.
doing the same thing.
This is what we were talking, oh no, there's another one here. The removal of cells by scraping is called what? FNA, total excision, or curettage?
Curettage.
Curettage. What's the FNA? Did everybody hear that?
No.
FNA is fine needle aspiration. Okay. This is what we were talking about earlier, guys. The stage, grade, or histology of a tumor is the evaluation of the degree of cellular differentiation.
I can't get into my Wi-Fi. Every semester I have this problem.
Did you change your password?
Probably, and I always forget if we put in like just the numbers or the S and the numbers or the whole address.
It's the whole, I do the whole address.
That might be the problem. I'm sorry, what was the question? I give up, I'm done, my battery's almost dead.
Okay, so this, don't you have a,
I have a phone, yeah, but.
no, I mean, don't you have a charger for it that you can
Oh,
charge?
yeah, I didn't bring it because I'm a teenager today, I guess.
Okay,
My son is the same way.
okay, so the stage, the question is the stage, grade, or histology of a tumor is the evaluation of the degree of cellular differentiation. Grade, yeah, okay. But let's skip 31. Kat, would you like to do 31?
Someone would know.
Why are we
So now I'm
skipping?
curious.
Okay, we can do 31. According to Bergoni and Thibodeau, factors that may influence the sensitivity of a group of cells to ionizing radiation are, so there's 4, and then you have 1 and 2, 2 and 3, 1, 2, 3, 1, 2, 3, 4. So
Definitely 1 and 2.
mitotic activity, time of cell division, cellular differentiation, or length of mitotic activity.
I don't know.
2 and 4? Wait.
It's actually C, 1, 3, and 4.
Oh.
So you take out cellular differentiation. So it's mitotic activity, time of cell division, and
Wait,
length of mitotic activity.
wait, you said 1, 3, and 4.
What?
You said it was 1, 3, and 4?
1, 3, and 4.
So that would be.
Oh, I'm sorry, I'm sorry, time of cell division, sorry. So it is, I apologize, it's 1, 3, and 4. So mitotic activity, cellular differentiation, and length of mitotic activity. Just let me check that, 31. Yeah, C. Okay. Think back to your, the next one, think back to your, radiobiology or your cell biology. Cancer management modalities such as radiation and chemo work by interfering with or modifying DNA synthesis. The synthesis occurs in the what phase of cell division? So it's S, M, G0 or G1?
S.
Huh?
S.
S? Are we sure?
I just read about that. last night. Yes, that's my final answer.
Yep, you're right.
Dang, you trying to trick
Just
us?
checking.
We're gonna get on the boards and be like, "Are we sure? I don't know. I'm gonna have
This is
PTSD."
why I have
Yeah. Sorry, it's been a long week.
You're telling me.
Yeah.
I've got a new class started, so it's been a long week. Okay, let's do 33. This one's a scenario. Miss, you know that college is closed on Monday, right?
Oh yeah. Are we? Do we go to clinic on
You
Monday?
can,
Okay.
yeah.
Do I have to? You don't have to.
You don't have to if you don't want to, but you have to let them know that you're not committed.
What'd you say? Oh, you didn't say something? I thought you looked.
They're the ones that told me. They said Monday's a holiday, so you don't have to come. And I was like, okay. That's what my people said.
Well, if they tell you not to come, then that's fine, but.
Morgan, where are you?
Like, look,
Oh.
They don't care, honestly. They're so chill over there. I love them.
yeah, it's a nice place.
I just asked because there's a therapist in Gainesville that was always all over that. She was like, every time we had a holiday, I was not in clinic.
They
Just
told
so
me
you
they
know this is a
said-
holiday coming up, right? And I'm like, I know.
They told me, they said, you're a student. If somebody says you can leave early, don't be like, are you sure? Just go. Just
Yeah,
They said, just take advantage of it because when you start working,
You
no
don't
one's gonna
get that.
ask you if you
No,
want to leave
you
anymore.
don't get that.
I was like, true. Okay, bye.
There are some clinics, however, that will let you work when the school is closed, but there are some that do not let you work if the school is closed. Okay, so this is a scenario. Mr. Jones and Mr. Smith have larynx tumors. Mr. Jones's tumor is classified as T2. Mr. Smith's is T4. What difference would you expect to see in these tumors?
This is bigger. Side.
Bigger, okay. What else?
Nodes.
Pardon?
Nodes.
You would expect nodes, yeah. What about the treatment fields? Would they be larger? For T2, T4 as in T3, T2? Yeah? Okay. And spread, so T4 spread, larger fields, larger folds, yeah. Okay. Palliation is to treat for cure, treatment for relief of symptoms, the skin color indicative of low flow oxygen, treatment to prevent the manifestation of disease.
B. Symptoms.
Yeah, treatment for relief of symptoms, okay. Okay, so we've got true and false ones here, so let's see. One of the so it's true or false. One of the characteristics of benign tumors is that they are never fatal. True or false?
False.
Why?
Because anything can happen. You can't say it's never fatal.
Depends on where it is, right?
Yeah.
It could be here in the thyroid and it's growing and it's stopping you from breathing. That's fatal. Yeah. Okay. A patient being treated with radiation to the abdomen will experience epilation of the scalp.
False. Unless they're on chemo, maybe.
You'd be surprised how many people actually say that.
Well, we've had, I don't know about that particular situation, but we have had some come in who would say, I'm having a problem with this, it's the opposite end of their body.
Yeah. I had a gentleman, literally I was treating his foot. And he was complaining that he had lost his hair all over his body. So he wouldn't take my word for it that it wasn't true. So we got the doctor in and he looked at me and he said, are you sure you're just treating his foot? Yeah, sure I'm just treating his foot. So yeah.
Well, I mean, for him to lose hair all over his body, he'd have to be treating his whole body anyway. So that's a hard thing to mess up on, to
Yeah.
treat someone's entire
Yeah.
body.
But this is a connection. It's the same as when you're treating a big toe and somebody's complaining of diarrhea. You know, I mean, it just. Anyway,
Breast patient said we were causing a rash on her forehead, so.
a breast patient?
Yeah.
Treatment
We
slipped, huh?
actually had the same thing.
She's like, I
Just the
got
other
a
day.
rash on my forehead, that's from y'all, right? I'm like, no, you should probably ask your primary about that.
Yeah, not on chemo or anything?
No.
Okay, yeah. Looks good.
Oh,
Big
boy.
enough for all of us?
Yeah.
That's massive.
The cinnamon crunch.
Okay. Okay. The term for transmission of disease from the original site to one or more sites elsewhere in the body is metastasis. True. Okay. Oncogenes are also known as tumor suppressor genes. So what are they?
The anti-oncogenes are the suppressor genes.
Yeah. Let's see what it actually gives you. Yeah, it's anti-oncogenes that are known as tumor suppressor. Yeah. In general, children have a higher incidence of cancer.
No, both.
False. Yeah, they don't. It's just better known that they get it, so it seems as if they've got a higher incidence. Surgery is never used prophylactically.
I'm gonna go with false on that one.
It's false.
Okay.
Can you give me an example of surgery being used as prophylactic?
BRCA gene and having a mastectomy.
Yeah, yeah. The BRCA, if you have and it's usually a double mastectomy they do then, and an oophorectomy as well. So, yeah. It may sound weird at the first thought of that, but yeah, that is false. Okay. We're now on page 32, number 41. Which of the following is not a possible side effect of cytotoxic drug? Not. Nausea, cardiac toxicity, myelosuppression, alopecia, or none of the above.
None of the above.
Factors considered in chemotherapy drug selection include which of the following? So histology, tumor location, rate of drug absorption, and tumor resistance to drug, so whatever.
I mean, I'd say all of them, personally.
Yeah, that's true, that's all of them. Yeah, 1, 2, 3, 4. The oldest cancer management modality is what? Chemo, radiation, surgery, or immunotherapy? Oldest.
Surgery, I thought.
Surgery, yeah. I mean, they were doing that in the Egyptians, so, yeah. Okay. Quick question before we go any further. I have an option for you. Do you want a break about 10:15, or do you want to go straight through and finish at 11:30? Or do you want to do both?
Yeah, both.
This week we'll do both.
Dang, you just had a really rough week, didn't you? Your students are worse than us?
I know, right? That
Well,
can't be.
it's remember when we started and we were doing 2 days in a row and 3 hours in the morning and 3 hours in the afternoon, 2 days in a row? That's what I was doing this week. So it was.
That was rough. I mean, it wasn't that bad because we were like at home,
Yeah,
but
but these were here, so.
but I don't know what's worse because like staring at a computer screen, that would get really bad. I used to actually take my laptop and like move it around the house with me
Yeah.
and clean and stuff. And actually, that helped me pay attention more than just sitting and staring
Yeah.
at the computer.
Yeah, doing,
And you got Stephen with his mic.
Oh my god. He was like, why does everyone pick on me? And I'm like, Steven,
I don't know.
in the beginning of the semester, you could not keep your mic muted. My husband would walk by and be like, is that Steven?
yeah.
Mm-hmm.
Mhm.
That's Steven.
Yeah. Did you see the little clip about some guy working, and he was working obviously from home at that point, and oh no, excuse me, it was the wife that was working from home, and the husband wandered past on his way to the shower, and he was stark naked.
Oh, that's
The
a
background.
trend. Oh,
Yeah.
It's like a thing that people will, while their other is on
Yeah.
a call, will walk in naked and video their
Yeah, a mom
reaction.
did that to her kid when she was sitting in
Dumb.
the
They're like in a
the
meeting, so
entire
they're
second
like-
grade class saw her mom walk across the benches
Oh.
naked.
Oh, you mean in front? Yeah, I've seen that.
Yeah, not like. on
I thought you meant in
but-
back.
But, you know, I mean,
I was
I was lucky. I mean, I had a door to close, so, you know, apart from the cat screaming in the background, you know. But, yeah. Anyway, so we'll stop about 1:15 for about 20 minutes or so. Okay, where was I? Oh, yeah. All of the following are characteristics of malignant tumors except blood vessel invasion, rapid growth, encapsulation, or metastatic. See?
That's what I would go with.
Encapsulation.
Yeah.
No malignant tumors are encapsulated. One unique characteristic of substitute ureas, okay, is that they may burn the skin on contact, they can cross the blood-brain barrier, they are most expensive class, and they are exclusively used for metastatic disease. And I believe that that is, just for those, is B. 45.
What? I don't know. Let's
Okay.
see.
So it says only a small subset of cytotoxic drugs can cross the blood-brain barrier. Substitute ureas can cross this barrier, so that's a cytotoxic thing. Cancer warning sign most likely indicating breast cancer would be pain, a sore that will not heal, a lump or thickening,
Lumper thickening.
change in bowel habits, a lump or thickening. An incidence of cancer in a given area may be affected by
All the above.
race, environmental exposures, cultural practices, or all of the above.
All the above.
Okay. An imaging technique used to detect lung cancer would be ultrasound, routine radiography, lymphangiography, and venography. B. Yeah. Most lung cancers are found with routine x-rays, chest x-rays. Remember, everybody that goes into any doctor's office or hospital always gets a chest x-ray. Doesn't matter what they have, they always get a chest x-ray. Tumor marker for the detection of germ cell tumor is PSA, CEA, CAP, beta HCG.
Would it be a PAT? No, that's never mind. Tumor marker. Would it be?
The last one.
That's
It's
what I
the
was
last
thinking.
one. It's
HCG.
beta HCG.
Germ cell.
Germ cell. What were you thinking?
I don't know.
Okay. The American Cancer Society recommends what for men beginning at the age of 45?
Pap smear.
Is that in there?
Annual pap smear, manual testicular exam, colonoscopy, or annual chest x-ray.
Well, isn't colonoscopy 50?
No, I thought it was 45.
They are going to be dropping it to 45,
They should, for sure.
but it's still officially 50,
Oh.
yeah. So let's see what it says here, because I'm not sure.
I would say testicular.
45.
I would say test.
Oh, beginning at the age of 45, men and women should have a minimum, a baseline colonoscopy check for polyps. So, yeah. So it is C, yes.
Well, that's like breast, I feel like they're pushing that sooner and sooner too.
Well, it should.
What?
Getting your breast exam, your mammography,
Yeah.
they're pushing that sooner too.
I feel like you should have a baseline mammogram when you're like 20. Just to see, like, this is what your breast tissue
Well, the
looks like.
problem with having it at 20
Too expensive?
is that your breasts are very dense at that age. So they're really, a mammogram is not really that good at picking up small lesions in dense breasts.
Yeah, but then
So
you can
that's-
get somewhat of an idea of, like,
Yeah,
this is what,
I
or
would
maybe
probably see
25.
30. I would probably see 30. And it, depending on whether you're a high risk or a low risk. Excuse me, a high risk or a normal risk. If you're a high risk, yeah, start it at 20, or as soon as you can persuade your physician to do it. And 40, yeah, or 35. Okay, so here's another thing here. Mr. Anthony and Mrs. Anthony are chronic smokers. Mr. Anthony smokes 1 pack a day and has been for the past 5 years. Mrs. Anthony, smokes 1 pack a day and has been for the past 25 years. Who probably has the greatest risk of developing lung cancer? And explain your answer.
Why is this a
Tends to be
question?
easy,
I was
but-
gonna say, this just seems a little too obvious that it might be wrong.
Half a day for 25 years?
Yeah,
I feel like she's a bad
God.
influence on her husband.
That's bad.
that's not as bad
Or
as
it's-
some people.
Like, we could just assume that she's done more damage over.
Yeah,
yeah,
years
she's
compared to
basically-
5.
Yeah,
If she
Mrs.
still has
Anthony,
25 years of that, she might be alright.
yeah. However, here's another one. If Mrs. Anthony successfully quits smoking next week, and Mr. Anthony quits 10 years later, who now has the greatest risk of developing lung cancer? And explain your answer.
If she quits and he continues for another
If
5 years.
If she quits now, and Mr. Anthony quits 10 years later,
Wouldn't he, because he is currently smoking, like, even though she has more of a history,
It's still her, I think.
I mean, she'd still have the time for sure. The time under her belt.
Yeah. So it says here, I'll read what it says. It's actually quite interesting. No other factors considered. 10 years later, Mr. Anthony has a repeated exposure for 15 years. Because he was smoking 5 years, now he's smoking another 10. Although this exposure is shorter than Mrs. Anthony's 25 years of repeated exposure, after such a long period of exposure, quitting will not lessen Mr. Anthony's risk by a remarkable amount.
Does it lessen hers?
No. So it's still
she's
Mrs.
Still her?
It's still
Okay.
Mrs., yeah. Okay, so Briefly describe the following curative surgical procedures. Prostatectomy. What do you do?
Removal of the prostate.
Yeah, you remove the prostate. Removal of the prostate gland, so radical mastectomy.
That would be like a complete removal.
Breast?
Pardon?
I can never remember
Well,
radical.
It's removal of like breast tissue and
All
some
nodes.
nodes, maybe?
Is it
That
all
sounds-
Remember what I mentioned about a radical mastectomy? The whole breast and the underlying muscle,
Oh,
I know it was something else, but I didn't remember what.
plus the nodes as well.
Is it all nodes or just involved?
No, this is why we don't use radical mastectomies anymore. They basically remove the breast and the muscle and all of the nodes. So modified radical mastectomy now is what they sometimes use. So what is that?
Maybe just nodes and tissue?
So it's the
Breast
breast and the nodes, although it doesn't say nodes in the answer, but I think that's taken for granted. The whole breast and the involved nodes.
What does it say in the,
So no muscle and only involved nodes. Okay.
Well, it doesn't say nodes at all here, so.
what does it say, just breast?
It just says breast and removal of the breast while sparing underlying muscle. So it's sticking to mastectomy being breast. So it's not touching the nodes. Although these days, we would include the nodes in the mastectomy. But mastectomy, if you look up mastectomy in the medical dictionary, it's removal of the breast.
Right.
It doesn't say anything about the nodes, so this is where they're coming from. Does that make sense?
I'm just confused why they wouldn't like add nodes, because if the mastectomy is removal of the breast, and then like why would the modified radical mastectomy just be removal of the breast too, you know?
Yeah.
That sounds weird.
Well, radical mastectomy was removal of the breast and the underlying muscle.
Right.
Modified would be removal of the breast only.
Right.
No underlying muscle.
Right. But I don't, like if mastectomy is removal of the breast, like the whole
Yeah.
breast, and then
And why
why
radical?
would modified radical be
Yeah, just removal of the breast.
Just to keep things
That-
confusing.
Yeah.
Yeah.
So
And it seems like it would be-
Then you have a simple mastectomy, which is basically just removal of the breast. These days, what we count as a modified radical would be removal of the breast and all of the involved nodes.
Mm-hmm.
A simple mastectomy would be just removal of the breast, and they check the nodes, they don't necessarily remove them.
What's segmental mastectomy? Is that just a section of
What?
tissue? Segmental?
Segmental is removal just of a part of the breast. So it's basically a segment. So you would remove maybe this part of the breast. It's slightly bigger than a lumpectomy. Okay. Exenteration.
I read it as extermination, to be honest.
Exenteration.
Complete surgical removal of a body organ, especially the eyeball, and other contents of the eye socket.
Yeah. You read it, didn't you?
I did.
Yeah. So let me ask you something. If externalization is removal of the eye and all of the contents, which means all the nerves and everything else, what is enucleation?
That was not complete removal, they just popped it out.
Yeah, enucleation is just removal of the eye. You leave everything else alone.
Just the eyeball itself.
just the eyeball itself, yeah. Okay, so prophylactic therapy is intended to relieve pain, heal or stall ulceration, fungating, or fracture, improve the quality of life, or sterilize area of microscopic disease.
D.
D,
Yeah.
okay? Curative therapy is intended to relieve pain, heal or stall ulceration, fungating, or fracture, totally eradicate the disease, or counteract the presence of hormones.
C.
C, yeah. Okay. So we'll skip the think about versions of this. And how many have we got to go? Oh, we'll start. Okay, let's stop here. And I will see you back in 20 minutes.
The previous pass rates for your.
Registered pass rates?
Yeah.
Oh, the registered
For your
for these
former
classes, it's about 80%.
Ooh, two of us ain't
Well, actually, no, tell a lie. There's been some that have been 100%, but it depends.
The
you
average
see-
is 80 maybe.
Pardon?
Maybe like the average is 80.
The average is probably about 90. But the thing about it is, a lot of people leave it till late. My, and it always has been, my thought is, and I'll give you this for what it's worth, is get your registry done as soon as possible. Because you forget things. You can say, oh, well, I'll study later, but, you know,
That's how I feel.
or I'm
now.
not ready, I'll do it next month, and then it's 6 months down the road and you've forgotten everything. So do it as soon as possible.
I have a question. Does anybody ever get like 100% on it? Like get all the questions right?
Probably not. Geez.
Like I just want to know if there's like, huh?
Or like a super low.
Well, yeah, I
I
want to
think
know what
it's
that is.
possible, but
just for
I
fun.
don't think, I haven't heard of anybody actually getting 100%. No, it's possible, if you
Yeah.
got absolutely everything exactly right, yeah, it's possible.
Just for funsies, I just want to know.
And there's how many questions again?
200.
The last I checked, it was 220, I think.
And you have to get C.
Well, like 30
You
of
have to
them are
pass with 75.
like 30 of them are like unscored.
What do you mean unscore?
Like they're just.
Well, it's
pilot
actually, I think
questions.
it's 20 that's unscored, but yeah.
What does that mean?
It means that you do them
I was just reading the thing.
to get your hand in, as it were, or get your brain in here.
Practice question.
Oh,
Practice
so they're
questions.
not actually
Primers
part,
or something.
but then
Yeah.
they'll tell you like, okay, now you're starting for real.
Yeah. I believe that's what it
I thought it
is.
was random too. So I was reading like I didn't bring my folder, but I have the printout of like the what's on the ART like boards, and it says that it's 30 pilot questions, and I think it did say it was like random. I think that what it is to see like how people do on these specific questions to see if they want to use them in like future boards, because I know like that's what the
Yeah.
military does.
Right, yeah. Just be grateful that you don't have the type of exam that the EMS guys do. Because for one thing, they have,
They're adaptive.
they're adaptive.
Exactly.
So what that means is that as you go ahead and answer the questions, if you don't do well in one subject, they'll give you more. If you do well in one subject, they won't give you as many of that subject.
The national paramedic one, I think, is six questions, multiple choice.
Yeah.
They're adaptive.
And it's 6 questions as well,
Oh, we
so
got a new test this year.
It's like nearly 400
Yeah,
questions.
they took
Yeah.
off cobalt and added MRI.
They
If they're
changed the
saying-
test this January,
Yeah,
the registry.
Yeah. and we'll go over some of that as well. Okay, let's get back to the book.
Okay.
We've got 4 months, guys, so don't, or 3 months, so don't worry too much about it.
Oh, real quick.
One more.
Yeah,
Morgan, it
exactly.
says you must correctly answer 131 of 200 questions to receive a score of 75.
So you only have to get 131 questions, right?
35. Yeah, 131. 131.
But, and the one thing that you don't want to worry about is how well will I pass?
A pass is a
Just
A
pass.
pass is a
Yeah.
pass.
C's get degrees,
Nobody-
alright?
Nobody will ever ask you, what did you get in your registry? As long as you pass, it doesn't matter. If you get a 75 or a 76, don't worry about it.
I think that's fair because the way that they make the exams, the person that took theirs last month could have had a significantly harder exam than you.
Yeah.
Just because they got more math in-depth ones and you got more oncology on yours.
Exactly, yeah. So the one thing that you don't want to worry about is what somebody else has got. I mean, if for example, if you sit the exam the month after you graduate,
Call it whatever.
and that's the way you should do it, you know, as soon after you graduate as possible, so it's nice and fresh in your brain. And then somebody does the exam or does the registry 3 months after you. It might be a completely different registry because they vary the questions.
Everyone gets a different registry, right? 'Cause you
Yeah.
have one pool of questions.
Yeah.
Even if you take it the same month, you get a different
Yeah.
test.
Yeah, so the problem is that people get together and do what we used to call an autopsy on exams.
Mhm.
What did you do? What did you do? And then they want them sick because they think, oh, I've done terrible, I've done wrong, and then fail, yeah. And it turns out that, yeah, they didn't fail after all, but that's the one thing
If
that
you do
should
fail,
not do.
how soon can you take it again? Is there like a time limit?
I think there's no time limit per se, but I think there's a certain amount of time that you have to do between. And you know you can take it 3 times.
Right.
3 times in 3 years.
Pardon?
3 times in 3 years.
Yes, I think so.
So if you fail it all 3 times, what, you go back, that's it?
There's no option, you have to either
Not
Leave
or
it,
wait for
or
3
come
years.
back and do the program all over again.
Oh, you can't just
The-
take it in 3 years. You have to redo the whole
No,
program.
no, I'm saying if you fail it 3 times,
Mhm.
if you fail your registry 3 times,
Gotta go back
then
to
there's no
school.
option. There used to be an option where you could do a sort of refresher, but they've stopped that now.
Sheesh.
My therapist said that nurses can just constantly, there is no limit, they can just retest,
As much as they want to.
as many times as they need to pass. I'm like, oh, that's reassuring.
Yeah.
It took you how many times to become a nurse?
Oh,
Okay, great. Could you step away from me, please?
Yeah, that's probably not a good idea.
Yeah, I think 3 limit is good. You know, if you
Yeah.
don't have it by then.
You're obviously
gonna
not,
get it. Yeah.
yeah. So let's get back and at least finish this chapter, please, guys. Where were we? Oh, yeah. Effective cancer management should involve interactive communication between surgical oncology, medical oncology, radiation oncology, BNC, or all of the above.
All of the above.
It's always a good guess, and there's all of the above. Sometimes it doesn't work. The following is true regarding an excisional biopsy. Involves the removal of a portion of the tumor, generally appropriate for cure in a relatively small tumor, provides a definitive diagnosis, B and C or A, B, and C.
What was the second one?
Second one is generally appropriate for cure in relatively small tumors.
I'm going with the third. Was there only 3?
Well, there's B and C and A, B, and C. So B and C would be provides a definitive diagnosis and generally appropriate for cure in relatively small tumors.
I mean, I would say all of the
All
above.
of the above?
Yeah.
Excisional biopsy?
Excisional biopsy.
Well, because you will remove a portion of the tumor.
Excisional biopsy takes all of the tumor plus margin and can be used for early localized disease and also provide cell sample for cystology. So yeah, all of the above.
I thought biopsy was just taking a part of,
Well, no, if it's an excisional biopsy, it's taking the
taking the
whole
whole thing and
tumor,
then biopsy.
if they're small. Possible routes for cytotoxic drug administration, so chemo, intravenous, topical, internal,
I don't remember what that.
A and
What
C,
is?
and A, B, and C.
Definitely A and B. I don't remember what C is.
Internal?
Enteral?
Enteral,
Passing through the intestine
Yeah.
via the mouth. So yeah, all of the above.
all of the above. Yep.
A, B, and C.
Actinomycin D is what kind of chemo? Is it an alkalining agent, an anti-tumor antibiotic, antiemetic, or hormonal agent?
B.
B. Any advance on B or A? Let me make sure. I did circle it as B, but let me make sure. Yeah. Actinomycin D belongs to the anti-tumor antibiotic class of chemotherapy drugs. So it's B. So you'll notice that this next one is the same as we've answered before, only in a different way. And this is something that you'll sometimes get in the exam. You get 2 questions, they're exactly the same answer, or exactly the same question, but they're asked in a different way.
So the answer is A.
So the what of a tumor is an evaluation of the degree of differentiation.
Grade has a D and differentiation starts with a D.
Hmm? Sorry?
I said differentiation starts with a D, grade has a D in it, so that's how you remember.
Ah,
That's a good
okay,
one.
whatever works.
Did you hear that, Morgan?
I did, but there's still just, there are 2 similar.
She's got a mental block on it,
I have this weird thing with grade and stage, I just,
Yeah,
Well,
we'll
now you know
remind
to
me
go
later
more
on
depth.
and we'll do a depth thing on grade and stage
Next week. No.
next week, so that
Yeah.
we don't confuse her even further.
Yeah.
Okay. Generally, a lesion classified as T1, N0, M0 is likely a stage
1.
There you go.
So I hope they're all like that.
And what planet did you fall off of?
Industry for dummies.
Yeah.
Hey, when I get hope, there's nothing wrong with hoping.
Very true, very true. Okay. Which of the following is not recognized as a carcinogen? Ionizing radiation, asbestos, ultraviolet light, or crude oil?
Ultraviolet light?
What?
What did you say the last one was?
Crude oil.
What is
Oil.
Crude oil?
The oil that
Like
comes out of the
unrefined?
ground.
Oh, okay, yeah, I have heard of that.
I'm gonna say only if
Like
ingested.
unrefined oil.
Yeah.
not
So oil that comes
carcinogen?
out of the ground,
I'm gonna go
or
with,
as it comes out
I'm
of the
gonna go with
ground.
radiation.
What?
No, it's right. Crude oil. I mean, the only way I can see that bad for you is to ingest it.
I
So-
thought that people who came off of those ships came back with high risk for cancer. Could be wrong.
I would say it is
Why?
personally.
Ionizing radiation.
Ionizing radiation is carcinogenic,
Yeah.
right?
Yeah.
So is asbestos,
Yeah.
so is ultraviolet light.
Well, damn.
Crude oil is not a carcinogen. If it has something done to it to make it gasoline or the oil you use in your car,
Processing it.
that, when it's processed, then it becomes a carcinogen. But actually, the oil that comes out of the ground is not a carcinogen.
Can you drink it?
I mean, if you drink it, you probably
What
have some
the-
kind of-
Can you go swimming in?
Can someone try this?
You'd probably suffocate or poison yourself otherwise.
Well, I
Crude
mean,
oil
to
is
me,
not
that's
a carcinogen.
feel like you could burn
yeah.
Alright, that will stand down the registry, I will not get that one wrong.
And that's probably one that you would get on the registry.
Right?
Yeah. Where were we? Oh, yeah.
Question with different answers.
Yeah. A patient receiving radiation therapy to the brain is expected to experience epilation, diarrhea, dysuria, dysphagia. One would hope that it was only A,
Yeah.
but then you never can tell. A likely symptom of testicular cancer,
Painless lump.
thank you, is a change in bowel habits, a sore that won't heal, nagging cough, or painless lump. Painless lump, yeah. Okay, so the most widely used staging system, not grading, staging, is known as the what?
B.
So I have the therapeutic ratio, TNM, BRM, or ABDE.
I instantly wanna go with TNM.
And you're instantly correct.
Good.
Okay.
Good.
I feel like I've said that before and been
Yeah.
wrong.
Good.
No, that's the,
Because that was the only one that made sense for me.
that's the most common one, yeah.
That's the only one we know.
Yeah, the most common. I'm like, what are the other ones?
Gotta be this.
That's the only word I recognize,
Yeah.
so that's the answer.
Yeah, let's just skip a little bit on here. I'm not gonna,
Did you purposely skip over the first 9?
what?
The first page
Right.
of questions in this chapter.
First page
We
question,
started on 10.
we start on 10?
Yep.
Yeah, I skipped over those.
I figured,
Or they
and then I regretted asking as soon as I asked.
Well, it's, they're the kind of one that you have to work at.
I would be so happy.
They're the kind of, would you like to do them as homework?
Nothing.
No,
Then that's the problem, that's the thing.
I did actually already
You
do
can't give us
them.
homework when there's an answer key in the
Seriously.
back. You know we're gonna take
There's an answer key on the back?
Yeah, there's an answer key in mind. So you have yours with you?
No, I left it, I have the Laura Napa one, I have the Black and Yellow one, and I left that one at the house. I didn't know I was gonna do that one, I'm sorry.
Okay, no, this is the one we'll be using most of
I
the
did.
time.
I'm recording this though, so
I can review them.
we did talk bad about you. I was gonna text you and let you know that before you watched it.
My power went out in like the middle of the night.
We were talking
I
about
wouldn't have been here if I were you, but
Oh, shoot,
and I'm the one that said
During
it.
online class.
yeah.
Talking bad about me?
Well,
Oh,
Back in the
I
day when
see.
we used to watch videos, I said,
It's okay.
even in that microphone.
I'm sorry.
I like to warn. I like to warn
So,
Steven because he gets
Just
upset.
because we've only got another half hour, we will do,
I'll only cry a little bit.
Patient care,
Where's that?
which is starts on page 130. Okay. I'm gonna,
Freddie got one off. Your mic showed up, and I'm like, bro, I can only breathe out.
we're gonna skip, ladies and gentlemen, to number 14. Which is on page 131. Everybody got it?
I have one question about that.
Yeah,
It is about number 14.
say again?
It is about number 14.
Yes.
Kind of, in real life. So, at chemo infusions, when they take the needle out, they just throw it in the trash can. That's normal?
What? No.
Trash can?
That's what I thought.
The
It was
regular
not
trash can?
normal.
What?
Yes.
You're talking about the,
That's a safety.
The catheter or the needle?
the
They throw the
needle
whole thing.
with this whole thing.
They throw the whole thing in the trash can. At UF North. I'm going to pause this.
After assisting with an IV, the therapist must cap the needle before disposing of it. What did you do?
I was just sitting here and it just left.
Jumped off.
Yeah, okay.
I don't know, I guess.
So, what do we do?
Yeah, that's true.
This is something that we have to discuss as well. So, where do you put the needle? Do you cap a needle?
Yeah.
Yes.
Recap a needle?
We used to, back in the day. we
You
did.
never, ever, the needles that they use these days normally have a cap that is attached and is physically unable to recap the needle. Because it's a safety thing. But some places are still using needles that you can cap.
Now
In
you
that
cap the
case-
tattoo needles.
You do not recap.
That's what it's for though. It's like you don't even, the cap's not even on when you open it. On the tattoo needles.
Ours?
The cap is down, it's like a safety thing, so
Yeah,
then
Right,
you use it and then before you throw it in the box, you pop the cap on.
yeah. But that's not recapping, that's just part of the needle. That's a safety thing. But however, it doesn't really matter. You shouldn't recap it, you should put it straight in the sharps box.
Are you talking about like the little thing that's attached to your needle? You slide it up and it clips over the edge?
Yeah.
Yeah,
Yeah, I don't think that's considered recapping.
that's not recapping.
They used to make needles, I don't even think they do anymore, that the cap came off completely.
Yeah,
and you put it on
they
the
still
counter.
have them. They
Yeah.
still can get
I
them.
mean, I've been in a situation where the sharp container was gone because somebody emptied it and didn't bring it back, and I did an injection, and then I'm just standing there like, I don't wanna leave this on the counter, so I carefully put it
Yeah.
in the cap, because I didn't have any choice.
Yeah.
It's either that or leave it laying around.
But they still, all that aside, you
Yeah.
should never recap a needle. And you should always put it in the sharps box.
I don't think they make needles with that.
So, pulse rate of 35 beats per minute would be called tachycardia. True or false?
False.
What would it be called? Bradycardia. Okay, so, this is an interesting one. Match the following terms with the correct definitions. Oh, good lord. Okay, bluish discoloration of skin, cyanosis, okay? That's C, right?
Sure.
It has to be from the list,
Oh, I don't have a
Yeah.
book, so.
so just,
Really? Just listen.
okay. Stroke, CBA, yeah. Fainting, syncope. Profuse sweating, tube used to pass fluids, gases into or out of the body, cannula. An aggregation of blood. Pardon?
Thrombosis.
Thrombus, actually.
Trying to say.
Thrombus, yeah, okay. Okay, for what reason is anaphylactic shock the type of shock most seen in diagnostic imaging? So we have patients who come for diagnostic imaging procedures are weak and debilitated. Yeah, right, okay. Iodinated contrast agents are frequently used. Patients here have more allergies, and X radiation causes this problem.
Iodinated contrast agent.
Yeah,
Contrast.
B. Symptoms of partially obstructed airway may include cold, clammy skin, pallor, weakness, anxiety, flushed, hot skin, hyperactivity, confusion, labored, noisy breathing or wheezing, acetone breath, irregular pulse, noisy respiration. Which one of those partially obstructed airway?
C.
C, yeah. Alopecia, nausea, vomiting, stomatitis, and skin reddening are all possible side effects of radiation therapy. The correct response to someone asking whether he will experience them would be A. Yes, but they'll subside once treatment ceases. B. No, they rarely occur. C. The type of side effect that will occur is dependent on the specific treatment site and dose. D. You'll have to ask the doctor.
Well, I mean, technically C, but you should probably ask your doctor. I think that's
Yeah.
a better doctor
This is
question.
Well,
the answer all the time.
Yeah.
Most common I hear is, depends, it varies from person to person.
Yeah,
Some people don't get all of it.
Yeah, and it also depends on, you should look at the consent form. The consent form, usually the doctor specifies what the side effects will be. Or, you've got this alopecia, nausea, vomiting, stomatitis, skin reactions. If you're being treated in the pelvis, will you get any of these? You may get alopecia. You certainly won't get nausea, vomiting, stomatitis, will you? You'll get skin reactions and alopecia, maybe. But again, it depends on what area you're being treated, and these are common side effects you may or may not get. So don't worry if you don't get them, basically.
My therapist said that most of the head and neck patients, they lose a certain type of taste, which I thought was interesting. They said
Yeah,
usually it's
sometimes,
salty or sweet.
yeah, salty or sweet, yeah, and it can change. Okay, so.
So the
says-
correct answer would be C.
Sorry?
The correct answer would be
The
C.
correct answer probably would be C,
Okay.
yeah. D if you want to be safe and you're talking to a patient, yeah. But again, it depends on what the physician has told them, and the only way you know that is unless you were in the room when the physician was telling the patient, or you look at the consent form to see what he or she has actually written down as side effects that the patient may have. Okay, so it says radiation recall. What is radiation recall? The recurrence of the skin reaction when given certain chemotherapy drugs can occur after radiation. The recurrence of all radiation toxicities when given certain drugs, A and B only, or all of the above?
Recall,
It's A.
Recall. 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 Have you ever heard that? phrase.
No, I googled it. It's A.
What's A's up?
Oh,
Sorry?
the recurrence of radiation skin reaction when given certain chemotherapy drugs. Google
Really?
says it's an acute inflammatory reaction confined to previously irradiated areas that can be triggered when chemotherapy agents are administered after radiotherapy.
Are you telling me your skin memorized?
Yeah, it's,
guess.
That's kind of
if
bizarre.
you have radiation and then you get chemo, sometimes what happens is that the radiation comes back,
The radiation
the
effects.
radiation reaction comes back, so you'll get a reddening or a browning of the skin.
Do you think that has to do with the chemotherapy affecting the immune response?
It could be,
Oh,
it
yeah.
could be.
It says it remains a poorly understood phenomenon,
Yeah.
but increased awareness may aid early diagnosis and appropriate management.
Learn something new every day.
So the answer to that is D.
D. Wait, hold on. Well, because A says, oh,
And
Is D all of the above?
no, D is A and B only.
A and B. Oh, okay. Can occur
You get
years.
that?
What's B then?
Can
B
occur years
is
after.
can occur years after radiation.
Oh, you can.
So if you have, say if you have breast cancer and you have radiation to the breast, and then 4 years later, you come back and have chemo for some reason or other, some people find that the reaction to the reddening or the browning of the breast comes back. It doesn't last that long, but it comes back. Okay, we're back to number 21. So a patient with lung cancer has shortness of breath, a cough, facial and arm edema, and a neck distension. The therapist suspects that the patient has developed what? So the answers are cardiac tamponade, superior vena cava syndrome, pleural effusion, or tumor lysis syndrome. B. Pardon?
B.
C?
B.
B, thank you, B. I'm thinking pleural effusion, where did you get that? Yeah. So the shortness of breath, cough, facial and arm edema, and neck distension is the classical symptoms of superior vena cava obstruction. (22) The care plan for a patient receiving narcotics around the clock for pain control should include which of the following daily measures to prevent constipation? Digital examination for impactation.
Oh, no.
Use of suppositories. Regular administration of mild laxatives. Fluid intake of approximately 1,500 cc's a day.
Somebody, Juan.
C or D?
Yeah, that's what I
remember the
thought,
normal
too.
IV, I thought normal IVs were 800, so a little bit more would make sense. I don't know, I'm gonna go with C. C sounds safer.
C?
Sure. Sure.
What?
The mild laxatives,
Yeah. You usually do that.
I mean, they would still give them push fluids, I would think.
Oh, yeah, but
I just don't know, that number is what throws me, the 1,500, I'm not sure about. I think one IV bag of fluid is
yeah.
400.
So narcotic medications given around the clock have a tendency to cause constipation. Administering mild laxatives helps to maintain normal bowel motility. And you just ask them to drink plenty as well. But somebody who is on narcotics throughout the day probably isn't eating or drinking too much anyway. And if they're in hospital, they can do things like that. We are probably talking about an outpatient here. Okay. Patient receiving treatment for lymphoma reports experiencing numbness and tingling in the feet, weakness when ambulating, and dribbling of urine. The therapist should suspect development of diabetes mellitus, development of spinal cord compression, peripheral neuropathy, or production of ectopic hormone.
See.
I would say neuropathy.
I would
Sounds.
say spinal cord compression because of the tingling in the feet and numbness. Bad.
And weakness when ambulating, dribbling of urine. So why peripheral neuropathy?
Because tingling of the feet.
Yeah, but it also says dribbling of urine, which wouldn't fit with peripheral neuropathy, would it?
I wondered if maybe that can go numb too.
It's actually the spinal cord compression. And what it says is pressure on the spinal cord can cause compression of the nerves to pass through the spaces between the backbone and the bundle of nerves that extend downwards from the spinal cord. Compression secondary to cancers in the lumbar region or the lumbar spine may cause tingling in the lower extremities, trouble walking, and incontinence. Okay. Most common clinical manifestation of infection in patients with cancer who are neutropenic is fever, positive blood cultures, dysuria, reddening at the catheter site.
Neutropenic?
Neutropenic.
No idea what that is. I'm throwing fever out there for infection.
What's neutropenia, guys?
Something respiratory related?
Blood.
Neutropenic. It's a very low number of neutrophils. And the neutrophils are one of the cells that help with infection or help with battling infection.
So the options were what? Fever?
Fever, positive blood cultures, dysuria, and redness at the catheter site. Go with your first thought, guys. Fever. Yeah. Okay. Match the types of shock. Okay. So you have a list of shock on one side and the causes of the other one. So low volume of, so we'll go with the shock type. Anaphylactic, allergic reaction. Hypovolemic,
Low volume of circulating blood.
blood, yeah. Cardiogenic,
Heart failure.
heart failure. Septic,
Systemic infection.
yeah. Neurogenic,
Injury or emotional trauma.
yeah. Diabetic,
Hypoglycemia.
yeah. Okay. Match the drugs with the symptoms or conditions.
Oh, no.
Uh-oh.
So, allergies,
Benadryl.
heart arrhythmia,
Don't know.
What's on, how long is the list?
Yeah.
It's
There's
four.
only four.
Oh.
Okay, can you read the list?
Yeah,
Lidocaine,
Benadryl, lidocaine, Inderol, and lanoxin.
I'm going with C.
lidocaine makes things numb.
Inderol for heart arrhythmia,
Sure,
okay? Hypertension,
the N word at the end. Something that.
Lanoxin.
that's Inderol. Heart arrhythmia, they say is lanoxin. And cardiogenic shock was lidocaine.
Lidocaine for cardiac shock?
Yep.
Lidocaine?
I'm very confused by that too. I don't think
Let me check,
any of
guys.
these would be
Let
lidocaine.
me check. So Benadryl for allergies, lidocaine for cardiogenic shock, lanoxin for heart arrhythmia, and Inderol for hypertension. That might be worth just checking out. I will check it out for you guys later. I have 11:30, so why don't we stop?
It says lidocaine is an IV antiarrhythmic agent that has a moderate efficacy against ventricular arrhythmias. It is particularly useful in the setting of myocardial infarction
There you
or
go.
ischemia.
Cardiogenic shock. Yeah. Okay, guys,